Good afternoon. My name is Kate Trumbull. I'm Vice President for Federal Policy at Results for America. Thank you for joining us today for our webinar on evidence-based local responses to the impacts of COVID-19. We're going to start in just a minute, but I have a couple of logistical things to talk about before we jump into our wonderful speakers. The first is that Dr. Sharon Contreras has unfortunately had an emergency arise and won't be able to join us today, but she will be replaced by Dr. Whitney Oakley, Chief Academic Officer for Guilford County Public Schools. The second thing to note is that we are live streaming today's webinar on Twitter, so please, it's going to be a robust conversation. Please feel free to join us afterwards or continuing on social media in addition to today's webinar. And then lastly, before I jump in, I just wanted to note that we are joined today by Representative Mikey Sherrill, and her comments are off the record and not for attribution. Today's topic is very timely as the House of Representatives is going to be voting to pass, we hope, the American Recovery Plan today. This will be the first stimulus bill since the CARES Act last March that will contain state and local specific government funding. That funding could be used to support programs like the panelists will be discussing today, which are a mix of programs based in evidence and innovations that are building evidence, all towards what works to help communities recover and get back on a path to stability. Before we hear from our panelists, we are honored to have Representative Mikey Sherrill join us to provide some opening remarks. Congresswoman Sherrill represents New Jersey's 11th district, and she has an impressive biography that I will only hit the highlights of. After graduating from the U.S. Naval Academy, Representative Sherrill served for 10 years as a helicopter pilot and policy officer in the United States Navy. She then attended Georgetown Law School and before joining the U.S. Attorney's Office in New Jersey. In her capacity as an assistant U.S. attorney and now as a congresswoman, Representative Sherrill has focused on ways to strengthen communities and build strong ties between community organizations and government. In short, she is the perfect person to have kick off a briefing on how the federal government can support local communities to recover from COVID. Welcome, Congresswoman Sherrill.
Hi, thank you, Kate, for that kind introduction. It's really a pleasure to be here today and to speak in support of the critical work that our local governments are doing to respond to the COVID-19 crisis and to really jumpstart our economic recovery. Across the 4 counties and 54 municipalities that I represent, I've seen some incredible innovative programs developed by local governments during the public health crisis. Counties and municipalities in my district have pivoted municipal services with remote work, stood up COVID testing sites, and implemented shared services across our counties. Our local governments are the most immediate point of contact for our residents, and a focus on how local governments not only respond to the crisis, but examining what is working and what is not working has broad implications for our health, our safety, and the prosperity of our communities. When this crisis began, I stressed that our state and local governments would play a significant role in keeping our communities safe and ensuring that every American was taken care of. That's why I was proud to co-lead the bipartisan SMART Act last summer with Representative Pete King and Senators Bob Menendez and Bill Cassidy to provide direct funding to our state and local governments so they could continue providing the innovative and essential services that have kept so many of our communities afloat during the crisis. In New Jersey, our local governments have been at the forefront of responding to the public health and economic crises. They've operated small business relief programs to help hard-hit companies keep their doors open and their staffs employed. They've run food banks for families in need, and they funded COVID-19 testing sites throughout our counties. Without support for these efforts across the country, millions more Americans would be at risk of falling into poverty. And this is what we saw during the Great Recession, when the federal government didn't provide the critical assistance to our state and local governments. Those governments reacted by cutting innovative and important social programs, such as those targeted at keeping children out of poverty. This is one of the reasons I'm proud to support the American Rescue Plan the House will pass today if I have anything to do with it. I'm not going home until we pass that, because it provides $350 billion to ensure that our state and local governments can keep operating these essential programs that so many people are relying on right now. Another key piece of the recovery efforts by all levels of our government that I've strongly supported and that I continue to stress is innovation in our policy design. This public health, education, and economic crisis is unprecedented in our history. And many of the existing capacities that local governments, workforce agencies, and school districts have had for addressing issues just aren't working for our constituents. My children were coming up on the year anniversary of the last time they were actually in-person school. That's why more than ever, all levels of government must invest in high-impact, results-driven initiatives that meet our current challenges, particularly to combat the public health crisis, advance economic mobility, and support students in their recovery from COVID-related learning loss. Over the past 6 months, I've advanced legislation in the House to jumpstart this policy innovation. I was proud to work with Rep. John Katko on the Fund for Innovation and Success in Higher Education, or FINISH Act, which will help our institutions of higher education develop and scale evidence-based initiatives that improve outcomes in higher education, such as degree attainment. I'm also really excited to work with Rep. Susan Del Bene and Terry Sewell to introduce the Speedy COVID Test Act, which encourages commercial testing labs to streamline COVID-19 PCR testing notification to help patients get their results sooner. It's my hope that strong government incentives will create faster test results for patients, which will help reduce the spread by ensuring infected individuals know their status. Finally, I worked with Rep. Bill Pascrell to introduce the Prepare Long-Term Care Act, which creates critical infection control and emergency preparedness regulations in our nursing homes to make sure that these facilities are able to adequately combat COVID spread. Long-term care facilities have emerged as a major vector of COVID transmission and fatalities, and it's long past time we've updated our regulatory framework to ensure that patients in these facilities are safe. So I just want to thank you again for inviting me to give opening remarks for this outstanding panel. As we continue to reopen the economy and get kids back to school, it will be critically important that results-based policy is developed to ensure that the economic recovery is broad-based and that our most vulnerable students recover after almost a year of learning loss. I'm excited to hear from our esteemed panelists and look forward to continuing to work on these important issues. So now I'll turn it back over to you, Kate, and thanks once again.
Thank you, Congresswoman. It's my pleasure now to introduce our panel for the day. Our moderator is going to be Cecilia Munoz. Cecilia is a Results for America Senior Fellow and former Director of the White House Domestic Policy Council and the Director of Intergovernmental Affairs under the Obama administration. She is a Senior Advisor at New America and recently helped lead domestic policy for the Biden-Harris transition team. Dr. Lomax Campbell is the Director of the Mayor's Office of Community Wealth Building in Rochester, New York. Dr. Campbell has 17 years of experience in small business entrepreneurship, higher education, and government administration. His expertise encompasses management, organizational culture change, ethnic psychology, urban entrepreneurship, and inclusive workforce and economic development. Dr. Rachel Fulcher-Dawson is the Associate Director of Research Operations at the Lab for Economic Opportunity at Notre Dame University. Dr. Fulcher-Dawson has consulted with nonprofits, schools, and state governments and worked for the federal government at the Department of Education, as well as on Capitol Hill. At Notre Dame, she's a current adjunct professor in the Education, Schooling, and Society program and is an affiliate, of the Institution for Educational Initiatives. Finally, we have Dr. Whitney Oakley, who's the Chief Academic Officer for Guilford County Schools. Dr. Oakley has served as the Chief Academic Officer since 2019, serving more than 70,000 students across 126 schools. Under her leadership, along with Superintendent Sharon Contreras, the district has focused on implementing high-quality instructional materials and increased proficiency for all students in all tested grades since 2019. Welcome, Drs. Campbell, Fulcher-Dawson, Oakley, and Cecilia Munoz. Thank you.
Thank you so much, Kate, and then welcome to the panelists, and thank you to everybody who's participating in this important discussion today. As you heard the Congresswoman say, as you've heard Kate allude to, this is an incredibly important time in our country's trajectory, and it's an important moment to be lifting up what we know about how evidence can be driving the policy and initiatives that are best meeting people's needs in this extraordinary time when we are confronting both the dangers of this pandemic, huge challenges in the economy, the education loss that you heard the Congresswoman mention. It's an important time for policymakers to make sure that we double down on doing what we know works. And we have some experts here who can share some and are going to share some incredibly important insights that can help drive policymaking and the kind of impact that we need to have in this moment. So I'm going to start by sort of going around the horn and asking our panelists to describe the initiatives briefly that they are engaged with. And Dr. Campbell, we'll start with you. Can you talk about the Mayor's Office of Community Wealth Building, and in particular, the year-round Earned Income Tax Credit Disbursement and Savings Initiative?
Absolutely, and thank you, Cecilia, for having this opportunity for us to speak through our work in our respective areas. I'll start by saying that the Mayor's Office of Community Wealth Building was established in January 2018 as a way to structurally institutionalize the work around addressing extreme poverty in our community. The 2019 June timeframe was when the city was tapped to be a part of Bloomberg's What Works Cities economic mobility cohort, and our mayor had been looking to operationalize a strategy around earned income tax credits for residents who can claim the EITC. And so what we've come up with through our collaboration with internal and external stakeholders was a match savings program for residents who are eligible to claim their earned income tax credit and have at least one child to get their taxes done through our local VITA partner, IRS approved tax service provider called Cash, and thereby elect to have a portion of their EITC saved. We did an initial pilot prior to the pandemic where we were focusing on the opportunity to address the issue of income smoothing and financial stress that comes from unexpected shocks to a person's income or a blown tire or things of that nature. And as we were looking at that, we were initially planning to have quarterly disbursements of the saved amount with a match up to 50%, and some other groups would have 25% match and no match. So we had different treatment groups. And because of the pandemic, we ended up having that cut short. This second time around, from what we've learned from our initial pilot, we've retooled and now allow folks to save a portion of their EITC as a savings bond, which most folks are already familiar with. And we've shifted to long-term savings where they can save a portion and have that as a savings bond and receive the match as either a check or have it directly deposited to their bank account.
Thank you. Dr. Fulcher-Dawson, we'll turn to you next. Can you talk about your partnership with local governments and nonprofits to set up emergency financial assistance programs across the country? And in particular, we're interested in what kind of design principles have come up as most effective and who are they effective for?
Sure, thanks, Cecilia. So while a few of the studies that we're doing related to emergency assistance started prior to the COVID pandemic, most have been a direct response that communities have had to the urgent needs of people in crisis due to the economic and health upheavals of the year. LEO's currently conducting 10 different studies in 10 different communities focused on understanding the impact of these emergency financial assistance programs, which I will call EFA programs, to save some time and words. And we're doing these evaluations both with local governments and with nonprofits who are looking to address these needs of people in crisis in their communities. The local agencies want to get emergency aid into the hands of people who need it, but they're also equally interested in learning what's the impact of doing this kind of relief effort. And really, because of their commitment to both getting relief in the hands of people in need, as well as learning what works, we are able to be creating evidence alongside them that all communities going forward can use to run programs like this. The partners we're working with have designed these programs to respond to their own local needs. Primarily, this is focused on preventing housing and financial disaster. In terms of federal support, this of course has come to communities through the CARES Act of last year, and more will is set to come, depending on the legislation that will be passed, it sounds like later today. This federal funding, of course, goes to local communities who then decide how to, who have some ways to decide how to best spend that money for people in need. There are also private dollars that a lot of communities have started to raise to also respond to people in crisis. But in both cases, there are differences in design across a few different dimensions to get to that question. Some emergency assistance programs are directed at specific populations, so veterans or youth in crisis, while others focus on, specific things like preventing eviction and homelessness. And then still others focus on the funding method, basically comparing direct cash payments to individuals where they decide how to best spend that funding to address their crisis versus sending money to a third-party payer like a landlord or a utility company to avert crisis and eviction. And then finally, others are testing the generosity or the amount given to people in crisis. So to understand, what is the right amount and timing of this kind of support for people that really need it. Thanks, Cecilia.
Thank you. So Dr. Oakley, we'll turn to you to clean up just on this first round. So, and thank you for stepping in at the last minute. We really appreciate it. Guilford County is currently creating a high-dosage tutoring program. So can you describe it a little bit and the evidence, in particular, the evidence behind it and how you think it's going to help students address the difficulties that have arisen from having effectively missed being in in-person school for a full year?
Sure. Guilford County Schools has launched a comprehensive tutoring program. It's designed to address learning loss as a result of school closure. In partnership with North Carolina A&T State University, which happens to be the HBCU that graduates more Black engineers than anywhere in the world, we're hiring graduate assistants to serve our high school students who have multiple risk factors of not graduating from high school. Through the leadership of Superintendent Contreras, we're also prioritizing our most highly trained tutors to serve our incarcerated students to get them integrated back into the school setting. We've hired undergraduate students from local universities and 200 of our own high school students who meet certain academic criteria to serve as tutors, to get course credit and to get paid, and serve as tutors for our middle school students who are meeting risk factors. We believe that hiring our undergraduate students and our own high school students is an intentional strategy to help build the teacher pipeline, as these tutoring efforts could spark an interest in a career in teaching following their tutoring experience. When done well, when speaking of the evidence, intentional training for tutors and in partnership with high quality instructional materials, we know that tutoring can be more effective than 80% of other academic interventions. High dosage tutoring, or tutoring that occurs with regular frequency, 2 to 6 hours per week, depending on student needs and schedules, is more likely to positively impact student outcomes, and mentorships with tutors can build the social and emotional supports as we get students back on track, back in school, and ready to graduate from high school.
Thank you so much. So I'm interested that Dr. Campbell, both you and Dr. Fulcher-Dawson, your work focuses on, and it's really related to the legislation that that got described earlier, that's going to pass hopefully today. This is essentially about getting cash into the pockets of people who need it most and helping them, Dr. Campbell, in your case, with respect to sort of the timing of when it arrives and how it is available to people. So can you talk a little bit about what the environment was? You started this before the pandemic started. What the environment was which led to this creative approach, and how the impact of the pandemic has affected it?
Absolutely, and I appreciate the question. In our context, upstate New York, or Finger Lakes region of New York, our community came together over the last decade or so and decided that the biggest issue plaguing our region is extreme poverty. And this was on the heels of Governor Cuomo at the time deciding to divide the state of New York into 10 economic development regions and have those regions bubble up to the state those priorities that need to be addressed to inform state allocation. And so because of that, we launched the Rochester Monroe Anti-Poverty Initiative. And the mayor, in partnership with assemblymen and others at the time, sparked a number of initiatives aimed at addressing poverty, culminating with the creation of our office, where a lot of the mayor's or the city's efforts would be housed. Because we were looking at a way to mitigate financial stress in shocks, we started down this path. And prior to COVID, the idea was people tend to have issues that could be mitigated with a small nest egg of $350 in the bank account, a blown tire, for example, or the shortfall for covering the cost of their rent. And so we initially thought of if people saved a part of their EITC and we matched it and then dispersed that to them quarterly, they would have higher likelihood that they would have what they need when things happen, when things go awry. Since the pandemic has hit, however, a number of our local foundations and other financial institutions have come up with a number of different financial instruments to address the immediate need. And so we figured when we pivoted, the longer term goal of saving for a house, saving for a car, saving to seed a small business at some point, which we know are among the premier ways of building wealth in this country historically. Real estate, small business, things of that nature, playing the stock market. And so we pivoted to that, and most people that took up the original first year pilot were just interested in the opportunity to save. That was some of the feedback that we got. And we learned that the higher the match, statistically, the more likelihood that folks would be interested in participating. And so for year two, we focused on that longer term savings, as well as the higher match, because initially, as I mentioned earlier, we were looking at a 50% match, a 25% match, capped at $500 total for those in that group. And so for this current pilot, we're only matching at 50% for the portion that's going to receive it. So that's the background.
And you have an evaluation coming up, right, of the I guess, University of Rochester and also Notre Dame are collaborating on an evaluation. Is that right?
Yes, excuse me. Yes, the whole pilot is actually a randomized control trial. So we have a treatment group and those who won't receive the match, which is completely random. And so we want to see what the impact of that match also have on saving as well.
Let me turn to you, Dr. Fulcher-Dawson. Again, you're also working on cash assistance, basically. In this case, it's emergency financial assistance. Can you talk about the building, the base of evidence for other programs and communities? How might this work spread to other parts of the country?
Sure. So, the emergency assistance is not a new program. Communities do this already, just on a much smaller scale typically than we're seeing this past year. But there was an initial rigorous test of emergency assistance to prevent homelessness, and that was actually done by the co-founders of LEO, our research lab, Jim Sullivan and Bill Evans. And they were looking at the impact of a homelessness prevention call center that gave out emergency assistance to people at risk of homelessness in Chicago. And what they found in this kind of landmark study was that this emergency assistance reduced shelter entry by 76%. And that effect was sustained for up to a year. So one criticism or concern about these kinds of programs is they kind of kick the can down the road so that you give somebody assistance this month, but then the same problem presents itself the following month. And this study really demonstrated for the first time in a rigorous way that that's not exactly how it works, and that this effect of emergency assistance during crisis can actually be sustained for much longer term. And another interesting thing that they found in that initial study was that the people at the lowest incomes, so people with the fewest resources who received this assistance, this one-time emergency assistance, their likelihood of entering a shelter was reduced by even more, by 88%. So some important things were learned there, but of course we want to continue to build evidence, because these studies that we're now doing across the 10 different communities, we want to learn about different things. Like I mentioned before, if there are specific populations, veterans or youth or families with young children that benefit in a specific way with cash, or for specific types of needs that present during crisis, or also the question that I think is particularly interesting is this question of cash in hand. So are people able to receive that cash and then figure out for themselves their most urgent need is childcare so that they can continue to work, or it's a car repair, some similar things that Dr. Campbell was mentioning for the EITC study to test really, is that the best way to avert crisis for individuals and families, or which is the more typical model now, is it better to send the money directly to a third payer like a landlord or a utility company, which, of course averts eviction, but maybe doesn't address other things that happen during crisis for families. So in terms of scaling across communities, across our 10 studies, and there are others out there besides ours, we really are building actually pretty quickly a body of evidence that any community could then use to say, okay, we want to understand, or we want to run a program for this population in our community, or to address this problem, homelessness, or to have a sustained impact. So that's the other thing that some communities are testing, is kind of the amount of funding that really helps, and if it helps if you give it once or over a period of time like 3 months to make things a little more stable before that assistance ends.
So, and I see you nodding, Dr. Campbell. Well, let me ask one more question to the two of you, and then we'll turn back to Dr. Oakley and the tutoring program. I mean, I'm struck that both of you seem to be indicating that it's often like some kind of event that happens that could happen to anybody that really knocks families off course, because if they don't have even a modest pool of funds to draw from, something like a blown tire, as you say, Dr. Campbell, can make an enormous difference, and that therefore an intervention which is arguably a modest amount of money actually has enormous impact. Can you talk about, one, whether there's evidence of cost savings, that effectively if you can keep a family out of crisis, is there a way to convince a state and local government that actually that's worth the investment because there's savings down the line, in addition to obviously the effects of the well-being on the family? And then the second question is, look, we're about to have a major federal investment in putting dollars in the pockets of the very people that you're talking about, people who have been hit hard by the crisis that we're facing now. If you had a magic wand on how you would like to see the federal government really maximize the impact of what this bill is going to produce for people, what would you say? So let's go in the other direction and start, Dr. Fulcher-Dawson, with you, and then go to you, Dr. Campbell, and then Dr. Oakley will turn to you.
Sure. So probably for me, the best way to explain in terms of this kind of cost benefit question in these types of programs is, with a homelessness instance, we know that shelter entry is very costly for an individual, of course, and also for society. So any program that can prevent shelter entry, which can cost on average upwards of $20,000 per individual, is going to be important to understand. If we can prevent that for a cost on average, people in this Chicago study, I think it was around $900 that was spent in terms of direct aid. The cost is slightly higher just because there's some smoothing that happens, but it's a very cost beneficial intervention in that sense. So for a smaller cost up front, we're preventing homelessness, entrance into homelessness. But there's also, of course, the ripple or spiral effect, some people call it, of homelessness. So that it's not just entering the shelter that's costly, it's the health things that happen when you become homeless. It's the potential loss of earnings, it's the potential involvement with the criminal justice system. So when you start thinking about those costs to society and to the individual, if we can find ways to temporarily give cash on a one-time basis, or even a one or two-time basis if it's sustained for a couple of months, that prevent for the individual some very significant negative life events, then that's a huge benefit to that individual. But then if we look at the societal costs in terms of what policymakers might be most interested in, reducing health costs, of course, are important. Reducing entry into the criminal justice system, which is a very expensive way to to have people incarcerated, is very expensive. And then similarly with shelter entry, all of those things are much more costly than one-time temporary assistance. So I think that, helps build a pretty quick case for how important it is to get this right and to understand it, because it's certainly kind of the old, an ounce of prevention is worth a pound of whatever. So yeah, I think we're in good shape to really learn and inform policy on that front.
Thank you. Dr. Campbell, what would you add?
Absolutely. And first, let me say, I don't know if I should say amen or ashe for the opportunity to co-sign what Dr. Dawson has expressed. But I would say our intervention is both reactive and proactive, because one of the components we've done for the match program is to wrap financial counseling services and financial education supports around the program as well. And so we already understand that a blown tire could mean that a person can't get to their job, and they can therefore lose their place of employment, which has a number of effects, right? As we understand, on their ability to contribute to our economy and well-being and the stability of a household. Same thing with losing their place of residence. The other thing that I would lift up is that it also mitigates the social determinants of health, which are not often talked about when we start talking about community well-being and economic policy. And so I think those two things would largely significantly address why it's important to invest in this type of a program or these types of interventions. There's a number of cities across the country who have embarked on match savings programs, some of which includes New York City, Tulsa, Oklahoma, Newark, New Jersey, San Antonio, and Chicago. They've all implemented similar programs to address similar challenges. So that's the evidence base in terms of benchmarking. And also in our early research, we learned that the states of Missouri and Maine have state level family development accounts where earned income tax credit, or tax credits for corporations and other actors can go to fund these types of programs. And so as we look at the American Recovery Bill and where to allocate resources to have the greatest impact, I would love it if New York State would hold such an account that federal dollars could be funneled to support these types of programs on a statewide basis, but operated at the city level, working with nonprofit, public, and private partners.
Thank you. So this is so interesting. Returning to the subject of school, right, which is so heavily on people's minds right now. You all, Dr. Oakley, have used the CARES Act in some innovative ways to address education loss, or I guess unfinished learning. Can you talk a little bit about how the resources from the federal government are being deployed in the service of your students?
Sure. In alignment with the high-dosage tutoring, we have hired our graduate assistants, some of our own high school students, and some undergrad college students and local universities using CARES Act funds that are targeted to mitigate learning loss. Our initial efforts have focused in math because the national research trends indicate that learning loss is going to be greatest in math following school closure. In fact, the Center for Research on Education Outcomes in the fall showed that students could be learning as much as 232 days of math learning in an online setting. We also know that when students take and pass Math 1 has direct implications for their life trajectory, for their income, for how they persevere following high school. When we look at tutoring, the social and emotional benefits of mentorships that can be formed with tutors can positively impact students' attendance and their engagement as they return to the school setting. Having Black and Brown tutors who are engineering students and math majors and education majors serving students that look like them in our schools is a powerful strategy within our tutoring program. Also leveraging our CARES Act funding, we're closely tracking and intentionally providing supports to our most vulnerable students with tutoring efforts outside of the regular instructional day academic supports. But we know that learning loss is going to look different for each student, and blanket interventions are not going to suffice post-pandemic. We want to continue to recognize the impact of the pandemic and how it will be far more significant and long-term for students who are facing inequities before school closure. teachers and families are going to continue requiring differentiated types of supports and options. It's not going to be a one size fits all. So we've targeted some funding to hire tutors at the college level, the high school level. We're in the process of building a tutoring core under the charge of our superintendent, but we recognize we have a long runway ahead, and we're going to need to sustainably support our students through these learning loss recovery efforts.
So getting back to the question of the legislation, which is before Congress today, which looks likely to pass and be signed into law, right? One of the objectives of the legislation is to help provide schools the resources they need to get students back in the buildings and learning safely. If you had a magic wand and could make sure that the process really delivered what you needed most, what your students need the most, like what do you want Congress to know? What do you want the administration to know as it begins to implement this legislation?
Yeah, I mean, I know we have to prioritize the increased investment in accelerating learning and educational programming to address the academic losses, but also have to address the long-term impact of trauma on families. We're going to need more social and emotional supports, greater community access to mental health supports, investment in academic and social and emotional for our incarcerated youth, our homeless youth, children who are aging out of foster care. We continue to have broadband deserts throughout public education in urban and rural areas. These can't all be solved by school districts. And, we have to recognize that the impact of the pandemic on this generation of school-age children is profound. When we create a new vision, I think, as you mentioned, offer more flexible scheduling and programming, hybrid scheduling, having access to more professional learning days, and then also recognizing that the broadband access gap continues to be a reality. And the underfunding that has historically impacted public education was only surfaced as a result of the last 12 months.
Thank you. So I've seen some questions appearing in the chat, and we also asked people to submit questions when they were registering for the panel. So we have we have a variety of questions to ask, and I encourage folks also to use the chat if they have questions for our panelists. I'll be keeping an eye on that. Dr. Oakley, since you had the mic, there was a question about whether on the tutoring program, whether or not you have an evaluation planned, and whether or not you think you'll be able to provide information to encourage other similar programs around the country.
We do. We have worked in close partnership with our Research and Accountability Office to think about the inputs and outputs, to think about students developing math identities and how it could positively impact their engagement and their attendance, because we're closely tracking our students who are at risk of not graduating. We're able to really look at the potential impact of tutoring. So we do intend to have a full evaluation of the impact of this effort.
And then just one more, and then we'll go back to the cash programs and questions about that. There's an interesting question about how tutoring is delivered now in this environment, right, in this online environment, and whether you'll go back to in-person, whether you'll keep some element of online, and what you think that means for the quality of what you're able to provide to the students.
Sure. We were well positioned to be able to train our tutors, because our Board of Education and our superintendent has led the implementation of high quality instructional materials in math. So we knew what to train and how to train. We right now started our efforts with virtual tutoring, and so that we could provide flexibility for student schedules. I envision, just like school, that we're going to need to do a hybrid mix. We're going to need to have some face-to-face tutors who are able to serve students during traditional hours, in the evenings, on the weekends, work around student schedules who may have careers or be supporting their siblings, but also be able to provide that virtually. So I see this as a multi-pronged approach that will need to be offered both face-to-face and in the virtual environment as we move forward.
So going back to the question of cash assistance, and this is probably a question for both of you. We have a question from the participants about whether research shows that monthly or periodic cash infusions for households are more effective than an annual lump sum? I mean, Dr. Campbell, this is sort of the premise of your program, right? At some level, is that that spreading out, I forget the term that you used, is ultimately more useful to families if they face a short-term crisis.
Sure. So from the initial pilot, we were looking at the matter of income smoothing. And so showing that periodic disbursements of cash had better impact or better prepared people for when things happen later, just because a lump sum payout at some point in time, which is what normally is done with the earned income tax credit, tends to be spent. You know, most folks try to pay off past bills, they try to get caught up on things, and then they get some things for themselves. And so our prior study and other research have shown that when it's spread out, just like most people's paychecks, you know, it's better managed or able to be managed more effectively unless a person has an extreme amount of discipline and structure to how they do their finances, which is also why we were wrapping the free financial counseling services through one of our other partners and the financial education or financial literacy supports to that as well, to build both capacity and discipline. But by moving to the savings bond approach with a match to that via check or deposit to the bank, it fundamentally focuses on a different goal. Those families that are looking to save to buy a house and move from being a renter to a homeowner, or for those folks that are looking to purchase, let's say, a living room set or buy a car or seed a business. So fundamentally different goal. And having it locked up in a mechanism like a federally insured savings bond, which is reliable, very familiar, seems to be the best mechanism to do that for relatively short-term savings, a year.
And does this apply at all to the question of emergency cash assistance? I mean, is this even is this a question that you wrestle with, Dr. Fulcher-Dawson? Whoops, you're muted.
There we go. Yeah, so to a lesser extent, I mean, most of the emergency assistance programs are, well, the EITC program that Dr. Lomax or Dr. Campbell's talking about is, you know, a larger amount generally. And so the idea of smoothing it across a year and having quarterly disbursements functionally and fiscally just makes a little more sense to test that out. Whereas the emergency assistance programs, they tend to be smaller dollar amounts. And so, yes, we would love to understand if there's a way to give some sort of assistance that would provide longer term stability, what that looks like. And I think actually the legislation that is pending today has some interesting things in there that will allow us to understand that more, things like the child, you know, giving cash per child for an extended period of time and understanding how that impacts families with young children and school-age children. But I think for emergency assistance, it's more about what is the right amount, and time period comes into play, but it's still a pretty short time period. I think the furthest out any of our studies is testing is 2 or 3 months. So really honing in on support in crisis. And so defining crisis as being much shorter term. That's not to say there's not long-term crisis that many individuals have lived in this past year and will continue to beyond this. But these programs in particular are really focused on, you know, preventing homelessness. That's a major crisis with a lot of ripple effects. Or, you know, the other. So the outcomes we're looking at, to answer the question in a slightly different way, are really housing stability. So does this cash infusion or assistance to a landlord stabilize housing? So not just prevent homelessness, but keep people in the same housing situation longer term. So we'll look at that over 6 and 12 months for most of the studies, but also financial stability. So we're looking at things like savings and debt levels over, you know, 6 and 12 months also, just so that there's also, you know, a crisis can happen when cash is needed and not there. People can get into bad cycles of debt that are also very destabilizing for families. So if that can be prevented, that's also something we are testing across these different programs in different ways.
So let me ask, as you heard when Kate introduced me, I work at New America, and one of the things that we think about there deeply, especially in this moment, is the government's capacity to deliver on these ambitious programs that it's put together. So the child tax credit, for example, which is a major piece of this legislation, the innovation which has been proposed is to deliver it monthly as opposed to as a yearly tax credit, right? On the same principle, Dr. Campbell, that you just described, which is that it would be more useful to families if it came in monthly increments. That is an enormous change with respect to what we were asking the government to do with respect to reaching people every month. One, I'd love to know if you have, how much confidence you have in the government's ability to deliver in the way that is most useful to families, and whether or not in your own programs you've struggled with how to make sure that what you are trying to, that you're able to reach families in a way which actually gives them the access that you're hoping for, whether that's a struggle for local governments or for local projects like yours. So I don't know who wants to take that. Dr. Campbell, you just unmuted, so you win.
Well, I thought you were looking at me at first, so I wanted to make sure I was ready. I would say that when my office was created, the Mayor's Office of Community Wealth Building in Rochester, New York, we were the second office of our kind in the country. The first one is in Richmond, Virginia. And I saw this when I came over from higher education. I saw this as an intentional attempt to establish a counterculture within government so that innovative approaches that were truly community-based by virtue of the mission and principles of community wealth building would be able to test out what could work by engaging directly with community and then scale those successes throughout the rest of the governmental complex, if you will. And so as I see that trend where other communities are doing similar offices and focusing on more community-based economic development, entrepreneur-led economic development instead of traditional approaches, I do have increasing confidence that government's able to actually shift gears, you know, through amazing opportunities like programs, initiatives, and policy change. And I think it's going to take time, just like you can't turn the Titanic on a dime, right? But I do believe we'll get there. And I think that the climate is right. And I think that as we continue to use evidence to inform our decision-making, I think we will get there.
Dr. Fulcher-Dawson, do you have anything you want to add?
Sure. So, I mean, we need Dr. Campbell's in all our communities. That's one thing that would be super helpful to all of this, because, you know, what we find in our work is we partner with providers on the ground. So we're a research lab, but we have very quickly, in the 8 years our lab's been around, realized that the potential of local innovation is enormous. And the amount of, blood, sweat, and tears that goes into doing that work at the local level is extraordinary. But what's much more limited is the resources, is the dollars. So to me, what the federal role can be, and is, I've seen it work great. We've seen it work great in other areas where the federal government plays a role, is by really both incentivizing innovation so that communities understand they can take, intelligent risks to figure out what might work for people in their community to be more financially stable. So incentivizing innovation, but also I would say incentivizing evidence. So that can work two ways. One is either requiring some sort of rigorous evaluation so that when a program is designed in Rochester, New York, we have the evidence from that to then say, okay, we know this is the impact of this program. And communities like Rochester around the country could then say, okay, we want to do something similar. And we have some ground to stand on to say, we know how it will probably turn out for our community. So that both, allows the Rochesters of the world to continue to try things for their community, but also, incentivize scaling up so that attaching dollars to evidence-based programs is kind of that final piece. So paying for people or paying for communities, or like happens in the Department of Education with their I3 grant system, really, both promoting innovation, but also once there are proven programs, allowing those to scale by attaching dollars to communities that want to use evidence-based programs. And I know Dr. Oakley's program has pulled on evidence a lot in the design of their program. So I think communities have the appetite for this already, but attaching federal dollars to it certainly could expand it a lot more quickly.
Thank you. So I wanted to, we just have a couple more minutes for questions, and I want to turn back to Dr. Oakley. And there's quite an interesting question in the chat that kind of combines this notion of cash assistance with an educational question. And so it's a question about whether or not you have a reaction to the possibility of paying students or families that are at the poverty level for school attendance and for outcomes in schooling, for maintaining grades at a predetermined level. The questioner suggests that it might provide incentives, and I'm wondering what you think about that as the first question. And then I'll name a second question so that you can address them both, because we've only got a little bit of time. And that is, could you provide details about the selection of high school and college students as tutors instead of hiring staff? And which option, more school staff versus students as tutors, do you see as more impactful and cost effective? So it's a lot to throw at you, but love to hear what you have to say.
Sure. I mean, there's a wide body of research, right, on incentivizing and sometimes how it could lead to widening gaps that already exist, or when you tie it to things like training or paying for GEDs, that it has a positive impact. So I think if it's an intentional incentivized program that has collateral on both sides, right? So if we do this, then you do this, and here's the intended outcome, that it could be beneficial. I also think, we had parents and interpreters when we were trying to increase our census rates going door to door in the midst of a pandemic. So there's plenty of opportunities to incentivize and pay to do larger community good. Our high school students who are receiving compensation and credits for their tutoring efforts are more likely to stay engaged in their own instruction. And so I do believe that there are benefits to this incentivizing piece. In terms of who we hire for tutors, we have positions posted right now for our very own classroom teachers to take tutoring positions. We have 80 graduate assistantships, 120 undergrads, and then 200 of our own high school students. But in a district of more than 70,000 kids following a year of school closure, the door is wide open. So if you're willing to be trained and come, I do think the mentorship piece in particular from our graduate assistants from A&T and our own high school students could be beneficial in a way that's different from traditional classroom teachers serving as tutors, but there's certainly a place here for both. And given the number of students that we need to serve in a short period of time, we're training and hiring tutors to get us through the summer and plan to increase this effort as we move through the fall and the 21-22 academic year.
Wonderful. That is all the time we have for questions. So let me just take a moment and thank this really inspiring panel. You're doing tremendous, tremendous work at a time when your communities really need you. So thank you both for what you're doing, but also for sharing it with all of us on the panel. And with that, let me turn to Nichole Dunn from Results for America, who's going to close us out. Thank you all.
Thank you, Cecilia. I am Nichole Dunn from Results for America, and what a wonderful conversation. Thank you, everyone. Today, we've heard 3 excellent examples of how local communities have leveraged federal dollars to enhance recovery from COVID-19, and how the federal government can support these efforts in communities across the country by providing flexible dollars, defining and prioritizing evidence of effectiveness, and incentivizing evaluation-related activities. In addition to the examples presented today, local communities can use Results for America's recently released Economic Mobility Catalog to identify and implement evidence-based strategies to improve economic mobility. This catalog highlights nearly 200 promising and evidence-based interventions and case studies exploring how these strategies were successfully implemented to accelerate change. You can find the catalog as well as learn more about Results for America's federal work at resultsforamerica.org. We didn't talk about higher education in this session, but there are some evidence-based, really strong higher education programs. Representative Cheryl mentioned that she is working on a bill with Rep. Katko and US Senators Bennett, Young, and Scott on higher education called Fund for Innovation and Success in Higher Education, the Finish Act, to spur innovation in higher education system. The bipartisan legislation will promote flexible and innovative programs using evidence-based innovation grants and the pay for outcomes model to benefit high need students. Finally, a big thanks to Congresswoman Mikey Sherrill for her comments and the support of her staff on this important work. Thanks to our panelists, Dr. Lomax Campbell, Dr. Oakley, and Dr. Rachel Fulcher-Dawson, and our amazing moderator, Cecilia Munoz, for a wonderful conversation. And of course, thanks to all of you for taking time to learn about what works to advance recovery from the coronavirus pandemic in communities across the country. We will send a recap of the panel to everyone who registered and look forward to continuing the conversation. Thank you again for joining and have a great afternoon.